Good afternoon, my name is Michael Arnold. I'm a paramedic with Carey EMS, and today we're going to do a skills demonstration video on transcontinuous pacing. The goal and objective of this video is to learn and understand the reason and needs for external pacing. The objectives going to be covered is understand what patients need transcontinuous pacing, pad placement on the patient, selecting correct settings, knowing when you have obtained capture, and when to stop pacing. Transcontinuous pacing is temporary means of pacing a patient's heart rate during an emergency and stabilizing the patient until a more permanent means of pacing is achieved. Transcontinuous pacing is accomplished by delivering pulses of electrical current through the patient's chest, stimulating the heart to contract. The indications for transcontinuous pacing are symptomatic bradycardias, sinus node dysfunctions, heart blocks, along with conditions such as hemodynamically unstable patients with chest pain, pulmonary edema, bradycardias unresponsive to atropine, and altered mental status. We're going to cover real quick the process and procedures of transcontinuous pacing. First thing that you're going to want to do is you're going to want to hook your patient up to the 4-lead on the monitor, which is going to be your right upper, your left lower, your left upper, and left lower. You're then going to notice and note onto the monitor the rhythm that we have. What we have here is a bradycardic rhythm of 40 beats per minute. You're going to note the status of your patient, whether it be that they are unresponsive, altered mental status, any other signs and symptoms along with a symptomatic bradycardic patient. First, we're going to apply the pacing defibrillator pads. You want to go with the anterior, posterior placement of the pads, and the reason for this is placing the pads in the anterior and posterior position is because it minimizes transthoracic electrical impedance by sandwiching the heart in between the two pads. Once we have done that, we're going to click pacer on your monitor. Most monitors will be preset at a predetermined rate. Ours is set at 70 pulses per minute. You're going to note the triangles, which are sensory markers. You want it to be over the QRS. If it's on any other waveform, you want to try and reset and troubleshoot. Once you have that, you set the rate, and now we're going to set the milliamps. By doing that, you click current, and you want to go up at 10, and you want to note that you have pacer spikes, and you want to keep going up until you have obtained electrical capture, which is having a pacer spike before each QRS, and then we set that. After setting that, you then want to observe on the monitor, check for corresponding pulse, which means putting your finger on the carotid, femoral, or radial pulse. This is making sure that you have mechanical capture along with electrical capture. Also noting any changes in your patient status from blood pressure to mental status and any other changes. Another thing that you want to do is you also want to maybe print out at least a 6-second strip. The reason why you want to do this is because you can visualize the pacer spikes on the strip, along with noted pacemaker arrows at the bottom of the strip. One thing to remember though, when you are using transcontinuous pacing, you may have to sedate or use analgesic medications per your protocol, because this can be a painful procedure for the patient. So just make sure that you're doing the correct dosing and following your protocols.